Thanks, Nakinski. And the People's National Party, in the meantime, is questioning why Prime Minister Dr. Andrew Holness has not dismissed Dr. Wheatley more than a week after the Integrity Commission recommended that 4 criminal charges be brought against him. The investigation report was tabled in Parliament on June 17, prompting repeated calls from the opposition for Dr. Wheatley to be removed from the cabinet. Opposition Senator Cleveland Tomlinson argues that the Prime Minister previously removed Dr. Wheatley from the cabinet during the Petrodram controversy several years ago over what he deemed a less serious matter. To some other news now, a suggestion this evening from church leaders to the government to utilize minimum user fees at hospitals to help raise money to improve service delivery. The call comes as cries continue to grow about delays facing sick people at hospitals and the burden on overworked staff. Details in this report.
The church leaders say they have identified 5 problems that need immediate attention. They include healthcare, bad roads, and the slow pace of the state's hurricane recovery effort. But the area which needs most attention is the health sector.
Many of our people are dying, and it is because of healthcare, not given the proper healthcare. We have shortage of nurses, and we have shortage of doctors. We have doctors in our congregation, nurses in our congregation. We can't see sometimes all 3 days consecutively they are at work. How can people work with such tired mind dealing with people? It is ridiculous.
Given those issues, the pastors say it is time to start a serious conversation about free healthcare in Jamaica.
We accept, successive governments' effort for free health care. But we are wondering if we are at that stage where we truly can give free health care.
Last year alone, public health facilities such as hospitals and clinics handled close to 3 million visits by sick people. Very big and expensive numbers.
But if we should take, should I call it a sultry 1,000, is it too much? From each patient, 2.7, that you are looking at least 2.7 billion Jamaican dollars, from user fees. So we're just wondering, if you speak to the health sector, if getting a minimum fee would not help the situation.
The clergymen say their approach would continue to allow free access to hospitals for those who can't pay, such as the elderly, disabled, and those unemployed. Prince Moore, TVJ News.